And we are kind of falling back to the advertiser's model. Dual income, no kids, the middle-agers, the young and... But that's not really the way consumers work. This is an emotion-laden industry, business. If you think about it, if your car messes up, you can be furious. If United Airlines loses your bag, you're really angry and you can go and tell grumpy stories to people who will tell you their grumpy stories in return. If the health of your children or spouse is endangered, that pegs the emotional meter. It is a different world altogether. And people who are sick look at these issues deeply differently than people who are well. And what language do you speak? Where do you live? Are you rural? Are you urban? Where did you immigrate from? Are you legal or not legal? Do you have children? Are you single? Can you get to someplace? Do you need to use the bus or do you need to use public transportation? Does your Buick work? Or Maslow's hierarchy of needs. Do you need to spend your money on food, shelter, and fixing your car? Zip code. There are a couple of organizations that are finally using this, by the way. One of whom is here. Any of you running health plans, you have a piece of data that most of you probably are not actually using, which is Zip plus 4. Because you have it in your enrollment file. Zip plus 4 tells you where people live to a remarkably accurate degree, and you can find from other sources all sorts of stuff about people based on where they live. Median income levels, median education levels, the language is spoken, cultural issues that can be incorporated. We're just at the very beginning. We tend not to use this stuff. There is a company that's using it in their health promotion wellness where they're using Zip plus 4 to target their communications to people and to try and increase the effectiveness. And it'll be very interesting to see what happens. In care, clinical care in particular, some of us are very oriented towards self-care. Other people are very passive and just want somebody to take care of me. Some people want lots and lots of choices. There's really good evidence that there's a lot of people that hate the idea of too much choice. It confuses them, makes them angry. Here's one example just to make your thoughts move a little bit. Value for low-utilizing members. Health insurance is not like property and casualty insurance, and people do not think of it that way. They will think of insuring their car or their house or even their life, fully hoping that they never need it. But healthcare you use all the time. Why should I pay all this money when I hardly ever go to the doctor? They think of it as a service model, not as an insurance model. Is there a way to retain value? The current system, when you pay your last premium, you're done. There's no retained value. It's not a prepaid phone card. Is there something that we could create, as an example, in a product design that would be worth something to these young and healthy people to keep them in the risk pool because of a retained value, at least over a period of time?